Hi everyone. Not too long ago, someone asked me for advice to help their family member who had just started their first job as a new nurse. I thought I would share my thoughts to everyone here as well. Here are 10 general practical tips, but please do not forget that nothing replaces good judgment, which I hate to say comes with experience. In this channel, I talk about all aspects of nursing. If you're interested in learning more about what it is like being a registered nurse, consider subscribing. I also would appreciate it if you would give the video a thumbs up if it has brought you any value. Lastly, be sure to check the description box where I have links to free ebooks I've created and some interesting products for nurses or nursing students. With that being said, let's get on with today's video. The first tip I have is be flexible. In everything you do, be adaptable and willing to change, especially in regards to your patients and their individual needs. Ask yourself, what's the bigger picture? Pick and choose your battles. Our patients' trust is invaluable when it comes to their healthcare. Tip number 2, sometimes doing nothing is actually doing something. There's a common phrase we have in the ER, fixing them to death. This is when we keep adding more interventions for the previous intervention that caused the first problem. After we tried to fix that number we saw on the monitor because it made us uncomfortable. This is more of an art and can be only learned from experience. I've had hospice patients that we withdrew care from and they got better and lived longer than their initial prognosis. Look at your patient and ask yourself what you're seeing matches what the monitor is telling you. Tip number 3. At the beginning of your shift, ask yourself, what are 3 things that can most likely kill my patient today? Prepare for those things as if they were going to happen. Be proactive in making sure none of those things can happen. This method will keep your patient safe as it prevents panic and reacting to the situation in a way that may cause them harm. Number 4, know why you are doing something. If you're asked to do something, anything by anyone, and you cannot provide a logical rationale to yourself as to why you're doing said thing, stop what you're doing and ask. If the first person doesn't have the answer, ask someone else. Keep asking until you know why. You need a rationale for your decisions or you will get into a dangerous territory of treatment versus harm. Many nurses get themselves into trouble by doing something based on unit culture without actually having a solid rationale. Find the policy and don't be afraid to ask the doctor. There's a reason they spent as many years in medical school as they did. As long as you come from a position of wanting to learn to help take better care of your patient and not from an attitude of questioning them, they won't be mean. They usually are more than happy and eager to help new nurses learn. Number 5, don't be afraid to say, I'm new, I don't know how to do this, help me. It will get you out of most binds and there's absolutely no shame to it. Number 6, never ignore your intuition. Trust me on this and trust yourself. You will know when you feel it. You could save someone's life. Sometimes that intuition is as simple as leaving someone's room and just having a gut feeling that you should go back. Just do that. Number 7, understand that you do not know what you do not know, and that's okay. If at any moment there is a question to what you're doing, stop immediately. There are no stupid questions in nursing, only life-saving ones. Number 8, you will make mistakes. The difference between a safe nurse and an unsafe nurse is the one who can admit when they are wrong and learns. You will meet nurses in your career who will not accept criticism. Be watchful of those ones. Number 9, try to have a general practice of never taking more than you're willing to give. This has to do more with your coworkers. It is okay to need help and to ask for help, and it is encouraged. Set realistic expectations for yourself and try to recognize when you might be over your head. It's okay. Patients' conditions change, and sometimes assignments can be unsafe. This is when you need to rely on teamwork. Just be willing to offer help on your good days as well. Don't be that nurse that finishes what they're doing, sits on their phone, and ignores their coworkers who are drowning. Think of it this way. Besides fostering good work relationships, if you help your coworkers out when they need it, they will be in a position to help you when you need it. Number 10, never accept the mindset of it's not my patient. At the end of the day, patients are human beings. I don't care whose patient it is. If they need help, just help them. Lastly, I leave you with my own quote, something I once said to a patient who asked me if I knew what I was doing. A question that you will get asked quite frequently. I said to them, I would rather be named a fool for admitting that which I do not know than to actually be a fool pretending to know something I don't. So there you have it. Those are some tips for new nurses going to work on a floor. If you like this video, please consider giving it a thumbs up and let me know what your comments are down below. I would love to hear them. Thank you so much for watching, and I'll see you in the next video.